The benefits of adjusting a pregnant woman are numerous. Right off the bat, helping low back pain. It's very uncomfortable to be pregnant sometimes. So just adjustment to the low back will help low back pain. There's also a lot of swellings with pregnancy. There's a lot of paresthesias in pregnancy, like carpal tunnel is very common. Intercostal neuralgia is very common, and those are from swellings in the body. And so the immediate effect of adjusting a subluxation is that you're going to introduce a lot of circulation into a certain area. So if a woman came in with a pregnant woman came in with carpal tunnel and we adjusted those wrists, it would help to move the circulation and really move the lymphatics through that wrist. So just that right off the bat will help that wrist. Now, we can of course adjust the neck, and those nerves coming from the neck that go into the wrist are going to be helped as well. But for somebody who's pregnant and probably a little swollen, would definitely want to look at the wrists if they were having a carpal tunnel issue. Intercostal neuralgia is pain in between the ribs. And that can be from swelling too. So adjusting the thoracics is wonderful. That will really help them to feel more open and feel like, they're carrying a lot easier. The pelvis is very important to be adjusted during pregnancy because the baby's going to descend through that area and the pelvis needs to open up. So if a woman has been keeping up with her adjustments during the pregnancy and those bones are being moved, when the hormones kick in and it's time to deliver that baby, the pelvis is going to understand a little bit easier. It's going to be able to open a little bit easier and to help that baby move down. There's a wonderful little ligament called the Utero-Sacral ligament. That ligament goes from the uterus to the sacrum, which is the very bottom bone in the spine. So if you adjust the sacrum, you're actually changing the tension on that uterosacral ligament, and you're allowing the uterus to move, to have less tension in it and to be able to move more freely. So there are case studies of pregnant women who have a child that hasn't turned yet, and they're 37, 38 weeks, like we're getting close, it's time, and in those studies, those women will go get a chiropractic adjustment, and the baby can turn more freely after that. So that's a beautiful thing for those women who, have a breech child and might potentially be able to allow, more room in the uterus for the baby to be able to turn. And even if the child is head down and ready to be delivered, just being able to open that pelvis and make sure the pelvis is ready for the child to come down would potentially make birth a lot easier and a lot more successful, and they can help to eliminate interventions that aren't needed.
Thank you for watching A Wise Way. Subscribe to stay updated, share to pass the knowledge, or view our other videos on the left.